Hello everyone. Let us understand about HbA1c test for diagnosis of diabetes mellitus. What is diabetes mellitus? Normally known as sugar disease, in which blood glucose concentration is increased. The normal blood glucose concentration is 90 to 120 milligrams of glucose per 100 ml of blood. To diagnose this, we have two tests are there. One, blood glucose test by glucometer. Second one, HbA1c test. Now in the first one, a glucometer is used on which a drop of blood is placed. That will indicate the concentration of glucose in the blood. Now, the concentration is dependent upon our meal intake. If you do the test after having food, the glucose concentration will be high. The reason is the meal usually contains carbohydrate. Carbohydrate is digested to glucose and glucose gets into the blood. So glucose concentration will be high. So to avoid this problem, doctor suggests to take fasting blood glucose level. That means in the morning before taking food, you need to check the blood glucose concentration. But that will tell you the concentration of glucose at that particular period of time. The second test, HbA1c, is known as Glycated Hemoglobin test. Hb indicates hemoglobin. Now, what happens is when you have glucose in the blood, the glucose may covalently bind with hemoglobin. Hemoglobin is a pigment which is present in red blood cells. Its job is to carry oxygen and deliver it to all the cells. So when glucose concentration is high, the glycation, the binding with hemoglobin, increases. So the normal range is 5.7% to 6.4% of the hemoglobin will be glycated. That means 5.7 to 6.4% of the hemoglobin will be bound with glucose. This value is roughly equal to 120 milligrams of glucose to 135 milligrams of glucose. Anything more than 6.5% of HbA1c indicates diabetes mellitus. Now, the advantage with HbA1c test is it gives you the concentration of glucose for 3 months period of time. Unlike blood glucose glucometer test, which gives the concentration of glucose at that particular period of time, HbA1c will indicate you the past 3 months glucose concentration in the blood. So this serves as an accurate measure to diagnose diabetes mellitus.